Hi, everybody. This is Susan Eichhorst. I'm a physician associate here at Basana Health and Wellness, and welcome to another webinar in our series here at Basana Institute. Hey, today I want to talk about an element called iodine. This is something that kind of got lost in my tool bag, and I'd like to bring it back for people to use. We're going to talk about what it is, why we need it, why we don't get enough of it, and how do you get more? So iodine is a mineral, which is actually a micronutrient that is essential for human growth and health. It is a relatively rare element. It's found primarily in seaweed, but it also is found in the solid rocks near oceans. This element was discovered and named in 1811, and by the early 1820s, it was used in France to reduce goiter or enlargement of the thyroid. And they had done this repeatedly and known that this was an effective treatment. Interestingly, it wasn't used in the United States for another 100 years. It wasn't until 1923, the University of Michigan conducted a study which showed in childhood, looking at childhood goiter development, that looked at 66,000 school-age children and found a 40% incidence of goiter or thyroid enlargement. And at that point, they finally decided to add iodine in the form of potassium iodide to our table salt. That was in 1924. By 1928, that study showed that there was a 75% reduction in childhood goiter. And by 1951, that incidence had been reduced all the way down to less than 0.5%. Interestingly, when you go back in the records, we find archaeological sites that confirm the use of seaweed chambers where seaweed was processed that date back around 15,000 years. What's curious about these chambers is that actually they're not found near the ocean. These sites were found very far inland. And to me and to the archaeologists, this indicates the importance of this important element to man. So iodine comes in a couple of forms, iodine and its reduced form, iodide. Reducing a element or chemical means you've added an extra electron to it. So iodine is not very water soluble and very difficult for our bodies to absorb on its own. So in 1929, a French physician named Jean Lugal discovered that if he mixes the potassium iodide with iodine, that greatly increases the solubility. And that has been known as Lugal's iodine, also known as Lugal's solution. And that's a mixture of 5% iodine along with 10% potassium iodide. Lugal's iodine is in a solution. It can be unpleasant tasting, it may stain, it can cause possible GI upset. So there is also a brand name called Iodorol, and this is a coated pill that is essentially Lugal's iodine. 2 drops of the solution equal 5 milligrams of iodine and 7.5 milligrams of iodide for a total of 12.5 milligrams. And that's what a small Iodorol tablet is, but they also make a larger dose in a 50 milligram tablet. It is true that you can get iodine from food. As I mentioned, seaweed has the most concentration of iodine. So you can find it in nori, kombu kelp, and wakame, which is used to make miso. You have to be careful with seafood. Seaweed can be like our seafood with respect to it can have contaminants in it. Plastics can incorporate into seaweed. Some of the heavy metals and the pesticides that are used in farming seafood and seaweed can also be contaminated. So that's not always our best choice. We find high levels of iodine in egg yolks. And here I really encourage people to invest in a pasture-raised egg. This will give you a darker yolk. It has more nutrients in it and is really a preferred form of egg to eat. Dairy products have been purported to have iodine, but unfortunately that's really only if they're fed an iodized or supplemented grain diet. Again, here I encourage my patients in the community to really get away from commercially raised beef, pork, and get into a restorative 100% pasture-raised farm for your beef, bison, and pork. You can also find iodine in cod, tuna, and shrimp. But again, here's the seafood problem. Even wild-caught fish are now being found to have microplastics in them. They may have some pharmaceuticals in them. They have other chemicals and heavy metals. So it's really cautionary with seafood these days, unfortunately. Why do we need iodine? So iodide, that reduced form, is what concentrates in the thyroid gland. There it's used to make the thyroid hormones, T1, T2, T3, T4. Each of those is an iodine molecule attached to tyrosine. and that's where those numbers come from. The breast tissue and the other parts of the body primarily use the iodine form. And here, that is why iodoral or Lugol's is so beneficial, because it has both forms already in there. Iodine has been used very successfully to relieve fibromyalgia pain and improve the brain fog that goes along with fibromyalgia for so many patients. It helps induce apoptosis or cell death to breast cancer cells. And it also improves cognition. It improves cholesterol levels. It can improve immunity. It can help with menstrual irregularities. It can help reduce allergy responses. There are a number of symptoms that iodine can help improve. Speaking of these iodine deficiency symptoms, they're kind of too many to list. Because this involves so many other body systems, the symptoms that go along from diseases of those different body systems can all be listed as an iron deficiency. When I talk about iodine in the breast, deficiencies have definitely been linked to breast cancer. There are case studies that will show the regression of breast tumors with the addition of 50 milligrams of iodoral a day. We've also been able to monitor and document the regression of breast calcifications that many women get biopsied, may be a precursor to ductal carcinoma in situ. And some of these lesions may go on to become cancerous. So if we can get rid of the calcifications at the start, then we may reduce that risk of the mutation in the tissue and the development of a breast cancer. One of the really wonderful things about iodine is that it greatly reduces the pain of fibrocystic breasts, and lots of women suffer from the pain of very dense fibrocystic breast. So this is one option for those women. Iodine in other glands and tissues, it's used by all glands in the body. It helps restore the mucous membrane. It helps heal the adrenal glands. It can reduce enlarged prostate glands. It's been seen to reduce fibroids in the uterus, uterine cysts, ovarian cysts, breast cysts. All of those things respond positively to increased levels of iodine. Why don't we get enough? Most of us know about iodized table salt. As I mentioned back in 1924, that's when we finally added potassium iodide to salt. So at least we knew that we were getting the least amount of supplementation to prevent some of the most dramatic conditions, such as a goiter. But iodized table salt really only contains about 77 micrograms of potassium iodide. And unfortunately, some of that iodine sublimes or kind of evaporates from the solid into the air. So it's been determined that probably only 10% is really bioavailable. So very small amount is what we're getting every day if you're using table salt. Barely enough that iodine or iodide rather to even produce good levels of hormones, but certainly not adequate for other needs. Add on to that it's estimated that only about 50% of Americans actually use salt at all, due to being told about restrictions for blood pressure, and that has put those patients in jeopardy. Iodine levels across the board have decreased over 50% over the last 40 years. And as we've also seen, thyroid conditions such as hypothyroidism, as well as the autoimmune conditions, Hashimoto's and Graves' disease, as well as thyroid cancer, all of those conditions have seen a steady rise over the course of that time, more than likely a relationship with the lack of iodine. But another component really contributes here, and that's these halides that are in our body. These are contaminants that come to us from the environment, from our food, and from our water. Specifically bromide or bromine, fluoride, chlorine, chloride, and perchlorate. Those are in our water supply. Bromine is in our food supply in most baked goods, and bromide is what is in fire retardant fabrics. I'll talk more about those in a moment. These have become really worldwide problems. We have seen a major increase in the risk of prostate cancer, breast cancer, endometrial cancer, and ovarian cancers over the course of those last 40 years. So bromide and bromine, this is one of the halides that is so harmful to humans. And one of the other reasons it's not healthy for us is it competes for the iodine receptor in a cell. It also can compete to where the thyroid hormone sits in the cell. So bromide is used in fire retardants, And so this can be in our furniture, can be in our carpeting, our drapery, it can be in children's pajamas, it can be in some clothing. You really have to look hard to make sure that it's not in your immediate environment and try to avoid it. Bromine, the other form of bromide, is actually used in our food as a dough softener or conditioner. It is in our baked goods that are commercially available. So think Entenmann, Sara Lee, Hostess, all of those are commercially large-scale baking products, and bromine is in all of those. Interestingly, bromide and bromine have been banned in the United Kingdom since 1990 and in Canada shortly after that in 1994. Banned in Sweden as a fire retardant. Interestingly, we used to use iodine in those bread products and those baked goods up until about 1970 when bromine was exchanged for that. So now we have more bromine coming in, less iodine coming in, bromine blocking the iodine receptors, really getting less and less iodine long term. There's no human need for bromine or bromide. And in fact, it has been shown that it can be carcinogenic to breast tissue. I can't help but wonder again, is that because it's competing in all those iodine receptors that may be more protective for the breast, and now you have chemicals sitting in there instead? The fluoride, chlorine, perchlorate, these are three compounds that are commonly found in tap water, frequently in low levels, but if you drink a lot of tap water and use it for cooking, then you're getting more than you need. Fluoride is a known neurotoxin. It really doesn't belong in our water. Chlorine, even if it's filtered out of your tap water, may get absorbed into your skin through your showering or bathing. So a good shower head that has a fluorine filter on it really can go a long way and it'll save your hair color as well and your hair. Perchlorate is actually a byproduct of rocket fuel and fireworks. And you may think, well, maybe that's not so bad. How many rockets are going up? Well, you'd be surprised how much of that contaminant comes down and lands in our fresh water. Unfortunately, the EPA is not too worried about this. A statement came out in late March of 2022 and announced that it doesn't plan to do any regulation on this perchlorate. So really best for us to know, filter our water. So again, how do we avoid these? So really you have to start doing your homework. I really encourage our community, keep reading labels. The more you know about what the food sources are out there, the more you will want to learn to cook, teach your kids to cook, buy your own food, make some of your own spices. Mixing them, really buying higher quality protein, and really knowing what is in more commercially available foods and snacks. So find products that don't have flame retardant in it, avoid commercially baked goods. Do drink filtered water. It's really worth it. Even a Brita is better than nothing, but really something like a Berkey that has a carbon filter, and you can actually add fluoride filters to it. I also like these new Go Pure pods. They're about this big. They have some kind of a very absorbent rock in there that will absorb all of these heavy metals. It absorbs 99.9% of all contaminants. You can put it in a water bottle. You can use it in a pitcher. Really helpful to reduce these chemicals that are invading our sprays all the time. It's nearly impossible to avoid all of them. So the more that you can do at home, the more you avoid in general when you go out because you've got less on board. And then why don't we get enough? So the RDA is set at only 150 micrograms for adults. They give a little higher leeway for pregnant and lactating women, 220 milligrams, 290 micrograms, respectively. These amounts are set really just to prevent that goiter or the enlargement of thyroid, but really not to promote health. You really need more iodine to promote optimal health, good endocrine or hormone health, immune health. This RDA is set way too low to prevent cancer as well. Speaking of the RDA, I just want to make a couple mention here so that you do start to understand where these numbers come from. So the recommended daily allowance is really the minimal amount of a supplement that is needed to prevent the most severe deficiency states, but not necessarily enough to really promote health and prevent other diseases. So two good examples is vitamin B3, that's called niacin, and vitamin D3. So B3 or niacin was found to prevent pellagra at 16 milligrams a day. Pellagra is a very old problem in this country. It's actually the lack and the severe deficiency of niacin. And what ends up with pellagra is you get diarrhea, you get skin rashes, you get some delirium, and regrettably, you can die from this condition as well. Vitamin D3, the RDA is set at 400 international units a day, and that is really only to prevent the worst disease of softening of the bone called rickets, which is very, very rare to see out there. The difference is really optimization. And the problem with the RDA is it really skews the impression of the general population, but also our medical doctors to understand what we can actually tolerate and what is the most healthy for us. So most providers only know about the RDA. Hey, the recommended daily allowance, that's all you need, you're good to go. But really, when you deep dive a little bit further, you see that high doses of vitamin B3, niacin, in the range of 3,000 milligrams a day, not 16 milligrams a day, has been very successfully used to treat schizophrenia. This is a 70 to 80% cure rate. That is pretty amazing. It also helps with depression. It helps reduce anaphylaxis in those that are very allergic. And it can reduce, we know it does a great job of reducing cholesterol levels and specifically raising HDL and lowering triglycerides and LDL. I will be doing a webinar in the near future about niacin. This is something that, again, came across my radar fairly recently and really had a personal impact for myself. And I want to share some of that information with my community so that you guys may find some benefits from using niacin as well. The optimization of vitamin D dramatically improves immunity, helps build bone, reduces depression, and I'm talking 10,000 units a day, not 400 units a day. That's what really gets these levels up into the higher optimal range of more like 50 to 80. There's a number of misconceptions about iodine allergy. So people will say, no, I'm allergic to shellfish. I can't take iodine. I'm allergic to IV contrast. I have a skin reaction when they use povidone iodine or betadine. That's a very rare occurrence. But all of these reactions are actually allergies to something else. They are not an allergy to elemental iodine. That is possible, but it's not common at all. The iodine that's used in IV contrast has nothing to do with the forms that are in Lugol. So that is not even a contraindication in the least. But Dr. David Brownstein and his partners have seen thousands of patients over the last 20 years, and they have only seen 3 people that had a true allergy to Lugols or iodoral. So I do think that we can feel that this is very safe for most of the general population. One of the downsides of starting iodine therapy and supplementation, though, is detoxing from these halides that I mentioned earlier. So bromine is the biggest one, but fluoride, chlorine, perchlorate. Symptoms of detoxing, again, almost anything, but significantly headache, fatigue, muscle ache, heart palpitations, kind of a perceived fever. You may check your temperature with a thermometer. You're not febrile, but you sure feel it. You can develop acne, get a rash, metallic taste, develop hair loss, GI issues, body odor, eye twitching, on and on and on. When we detox from a lot of these chemicals, there are so many different reactions in the body to having high doses or high levels rather in the bloodstream that these are the reactions that we get from them. So it's really potential for detoxing from halides. Obviously, if you're eating more commercially available baked goods, that's not in my case. I don't drink tap water. I filter all my water. I don't believe I'm exposed to much flame retardant. I certainly know not in my house. I haven't really changed any furniture or carpeting in the last 5-7 years maybe. But if you are detoxing heavily from these, unfortunately only 5% of people will have these strong detox reactions. You can actually get pretty uncomfortable from starting iodine, and next thing you know, you want to stop and you're done. But I really think that you need to know that we can actually alleviate some of that by doing a prevention, whether a saltwater flush prior to even starting iodine. Sorry, I had to plug my computer in. So when you do a saltwater flush, that is one way to kind of detox and clean out some of these halides, get the body prepared for starting iodine. I don't think most of my patients need to do this because a lot of them have already made very dramatic changes in their eating habits and understand more about the chemicals in their world. But a great flush is a half a teaspoon of Celtic sea salt in a glass of water twice a day. This can help bind up these halides, especially bromide, and help get them out of the body, kind of attached to the salt water. I am recommending selenium, at least 200 micrograms a day for everybody. This is an amazing antioxidant. It has got a great track record of reducing cancer risk, but it also aids in the production of thyroid hormones. So it is very helpful for the thyroid to have selenium to make these hormones that it needs. I strongly encourage magnesium glycinate, malate, or threonate. Those are the best forms that don't affect the GI tract. And for this detoxing flush, that'd be 400 milligrams up to 1,200 milligrams a day. How you pick these doses can really be on how significant your symptoms are. If you're even more stressed out, feeling worse, increase your magnesium, increase your selenium. Same with vitamin C. A buffered ascorbate powder is probably best, and you want anywhere between 3,000 and 10,000 milligrams a day. You can continue this detox flush anytime you are taking iodine. These are all appropriate minerals to add to your repertoire to help your iodine work even better. Lastly, it's these ATP cofactors. You may be familiar with ATP. ATP, adenosine triphosphate, is our energy that we use in our body. So this is made from the mitochondria, and it needs a couple of cofactors or helpers in the form of B2, vitamin B2, that's riboflavin, 100 milligrams a day, and B3, which is the niacin, 500 milligrams a day. Either the regular, where you have to get used to the flushing, goes away pretty quick, or a no flush, but only the inositol hexanicotinate. I always get that one goofed up. Hexanicotinate. Fortunately, iodine side effects themselves are very rare. You can get a burning sensation in your mouth, throat, or stomach, fever, stomach ache, diarrhea, nausea, a weaker pulse. Most of these side effects will be reduced with taking a pill form because it's coated and taking it with food. You can also get too much iodine. So iodism is too much iodine. That can leave you again with a metallic taste, increased salivation, sneezing, headache, acne, sinus headaches, especially up in the frontal zone, perceived fever. It's rare, but it can occur. And again, it can easily be resolved with the reduction in the dose, or you can actually add chlorophyll tablets, and that will help sequester some of that iodine. Again, I recommend with iodism, selenium 400 micrograms, unrefined salt, magnesium, vitamin C. All of those will reduce iodism. In the general community, many providers don't like iodine. They don't understand it. They haven't learned about it. They only know about the RDA. But I think what makes them most cautious is that we can sometimes see a transient rise in the TSH, or thyroid stimulating hormone. This might pop it out of range and make you look like you're hypothyroid and your medicines are not adequate. Interestingly, most of my traditional docs only check TSH, so they won't recognize that the free T3 and the free T4 may not have changed at all. The reason we see a rise in this TSH is really because it is increasing the thyroid stimulating hormone to increase something called a sodium iodide symporter. These NISs actually act to help more iodide get into the cell so that now that cell can do its job. Once this thyroid gland is fully saturated with all this iodine and made up for the deficiency, that TSH will come back down, usually back down to right about where it was or a little bit above, but back into range. So I've been taught so much about thyroid, and my patients really know, and I want everyone else to know, always trust how you're feeling. Your labs are a guide. They do not tell me how you feel. You can always adjust your thyroid medication and adjust that around iodine. Speaking of adjustments, we kind of look at the rule of thirds. So a third of the patients will reduce their dose in half, a third of the patients will keep the same, and a third of the patients will come off altogether. We'll see where you fall. We will adjust accordingly. Just know where you feel well. If your heart is racing, you're feeling jittery, you're shaky, you feel all revved up, then reduce your natural desiccated thyroid if that's what you're taking. Reduce it in half. See how that feels. If you're taking liothyronine, then reduce that by one dose or half of what you're taking and see where that is. I would leave your Synthroid or levothyroxine alone for right now because that is T4, and that is what's used as the storage hormone to convert over to T3 with these cofactors, iodine, selenium, things of that sort. Doses can always be adjusted. That never is a problem. We can always go up or down as we need to. The other question that comes up from a provider's perspective is autoimmune thyroid conditions, Hashimoto's and Graves' disease. So lots of controversy here. And this is, I think, what kind of got me hung up before I really went and did my own research and read a couple books and really feel more comfortable with the experts that are out there. Dr. David Brownstein who probably has some of the most high experience with iodine therapy. he sees that probably low iodine is the source of most AI development in the thyroid conditions, AI being autoimmune, not artificial intelligence. He feels that this is very safe for Hashimoto patients, but they may need a lower dose than somebody that has Graves or just general community. So I would start those patients, always load them up with selenium and magnesium first, at least a week or two, get those on board, then start the iodoral at 12.5 milligrams, maybe go up to 25 milligrams, and then we reassess from there. Graves patients, like myself, actually need higher levels and doses. And unbeknownst to me, before I had my thyroid irradiated almost 20 years ago for my Graves' disease, it would have been highly beneficial to be taking iodine before that procedure, but high dose iodine may have actually prevented me from having that procedure as well. So we need more iodine to protect against the radiation if you've been irradiated like I have, but also hopefully to prevent that and actually reverse the course of your disease. Why do I keep talking about iodoral? I just want to reiterate again, because iodoral is the tablet form of Lugol's iodine. Iodine can be purchased in other forms, but it's usually iodine or just iodide. Iodoral has a combination of both in the same percentage or milligrams as Lugol's has. And since the breast tissue uses iodine and the thyroid tissue uses iodide, that is why I will continue to recommend that you get a combination dose and get the iodoral. The dosing can be a little variable. Minimum of 12.5 milligrams. You can always break that in half and start a little bit lower. You may not have much symptom relief or even notice any difference, but I do recommend you take your iodine with a meal because this will increase the absorption, but it also reduces any GI symptoms. It's preferable to take it earlier than 2 p.m. because it may disrupt your sleep because many people find they're more energetic with iodine on board. Most people will feel best somewhere between 12.5 milligrams and 50 milligrams. Dr. David Brownstein starts most of his patients at 25 milligrams, but he also tests those patients with a loading dose test, and we'll talk about that in a second. Fibromyalgia and chronically ill patients actually may need much higher doses to start and then may be able to come down to a little lower dose once they are fully saturated and those levels are back up to optimal. So this testing I mentioned, you can do a spot urine test that will just check for the iodine that's in your system without being on anything. And from a dietary perspective, this is okay, but really I think the more gold standard would be to do a 24-hour clearing test where you take a 50 milligram tablet of iodoral and then you collect your urine for 24 hours. We give you a jug, bring it back to the lab, then that is measured for how much iodine is in that in that urine. What we want is more than 90% of whatever you took ended up in that can. But what we find is if you have lower levels, your body has taken all that iodine in and used it. And what's left is maybe 30% is left. Now we know you need more iodine. So that can be really helpful. But it's also known that upwards around 90% of Americans are actually deficient in iodine. So testing may not be necessary, but it certainly can be helpful and it definitely is available. Some of the iodine concerns, again, in the community that are a little iodophobic maybe, is developing this hypo or hyperthyroidism. Again, it's a very rare occurrence that we see a hyperthyroidism. You may see a change in TSH that your doctor may think you are hypothyroid, but honestly, these are both A, transient, and B, not very common in the fact of hyperthyroidism. If it continues and these thyroid levels continue to be very high, then we may want to look for a nodule on an ultrasound and see if there is a nodule, see if it's a hot nodule or lights up on a thyroid scan. That can be concerning because that may be the cause of why this thyroid is running amok, not the iodine. And then the other concerns with iodine in the general community, that's the medical community usually, is higher doses than the RDA. And I hope we have helped understand that. And then again, this confusion over autoimmune thyroid, but do know that Hashimoto patients may be more sensitive. We may see a rise in their autoantibodies. But again, most of my patients that have Hashimoto's really are well versed to understand that they get rid of gluten, get rid of conventional dairy. A lot of times we're able to really get those autoantibodies way down low. They're already taking selenium to help with that. So they may be able to tolerate easily 25 milligrams and get good breast health coverage as well as thyroid. When will you feel better? So some will see immediate improvement. I mean, 1 or 2 doses, they may notice, hey, my brain feels better. I have better clarity. I have more energy. While more chronically ill and significantly deficient people, or if you have a high bromide or halide toxicity, that really may take longer. And I mean 3 months, 6 months, a year. But please know that every time you are doing these positive things for yourself, even if you're not feeling all the results from them, that doesn't mean they're not working at the physiological or the cell level. So please don't lose sight of the good you're doing, even if we're not getting all the positive results. But my guess is you probably will. Higher doses also may be needed to really feel full effects. And in some chronic conditions, they're even giving upwards around 300 milligrams a day with total safety. So just kind of keep that in mind, that the variable doses are certainly something to consider. So I really hope that this has helped you better understand the numerous benefits of Lugol's or iodoral iodine supplementation. I really hope you feel more comfortable with its long safety record and using this in your armamentarium to help your thyroid work better and to help your breast age more healthfully, reduce our risk of breast cancer, help our body work more efficiently. It's really time to embrace this essential element and the importance of it on our health. I thank you so much for joining me today. I look forward to seeing you again next time. Thank you.